Hello guys, today I'll attempt to explain this question further and try to share the concepts that I've learned over these years. Today's question is why Faradic current is used for innervated muscles and galvanic current for denervated muscles. We usually say that for innervated muscles we would use Faradic current, and if the muscle is denervated or when the muscle gets denervated we would go for galvanic current. So why do we do that? Why do we choose the current like that? Before moving on to the particular use of Faradic and galvanic current, we'll just see about the different characteristics and the differences and similarities between Faradic and galvanic current. Now, low frequency currents. By low frequency currents, we mean the currents with frequency less than 1000 Hz, and particularly if we say about galvanic and Faradic current, these currents have the frequency lesser than 100 Hz. So why do we use these particular frequencies less than 100 Hz? It's because the most of the nerves, or say peripheral nerves, carry the impulses below with the frequency below 100 Hz. Like A alpha carries the impulses with 0 to 10 Hz, or A beta 80 to 1000 Hz. If we give something, some current with the same frequency, it can help us to stimulate those particular nerves and bring about the therapeutic effect that we intend to bring. Now, the low frequency currents that we are talking about are basically two types, Faradic and galvanic. So what are the differences and the similarities between them? When we talk about the frequency, the particular frequency is 50 to 100 Hz for Faradic. It means that the cycles will repeat for 50 or 100, it will range between 50 to 100 repetitions of those cycles in 1 second if we say it as a Faradic current. And when we talk about galvanic, the cycles or the pulses will repeat for 30 times in a second. That's why the range of frequency will be less than 30 Hz. When we talk about the pulse duration, the duration of one cycle or one pulse, it is less than 1 millisecond or less than 10 milliseconds. Few books say 1 millisecond and few books keep that point as 10 milliseconds. So less than 1 millisecond or 10 millisecond duration is for Faradic, and the galvanic comes with the duration more than 10 milliseconds. So the galvanic is the longer duration current and Faradic is the shorter duration current. Now when we see the overview of it, we can see so many waves or cycles in Faradic. It's because the frequency is high, there will be more number of cycles that will get accommodated in 1 second. And if we see the relaxed pattern of galvanic current, we can see the less number of waves that get accommodated in 1 second. Now, if we see 1 second, we can see a lot of waves in Faradic current, actually 50 to 100 cycles. That's why the frequency comes as 50 to 100 Hz. If we look at galvanic current, it can accommodate, the 1 second can accommodate only 30 cycles. That's why it gets 30 Hz, or if it accommodates less than 30, then the frequency will reduce further. Now, what is this? This is one of the knobs that we can find in traditional electrical muscle stimulator, in that this pulse duration knob, if we set that pulse duration along these ranges, then we should know that we are using the galvanic current in that particular setting. If we put that knob in anywhere around this range, that is 1 to 0.01, then we have to know that we are using Faradic current. So this side it's Faradic and this side 3 to 300 it's galvanic. So apart from the pulse duration and amplitude, we have to learn about area under the curve or area under the wave. What is the difference between area under the wave for Faradic and galvanic current? Okay. Now we can see this graph or this figure in which we have plotted along the y-axis. I have plotted duration. Along the x-axis there is duration. Along the y-axis there is amplitude. This amplitude refers to the intensity that we are setting with that intensity knob that is available in the electrical muscle stimulator. This amplitude refers to the current intensity. Now for the same current intensity X, if we are using Faradic current, the Z is the area under the curve and Z dash is the area under the curve in case of galvanic current. If we are using the same intensity X milliampere, the Z will not be equal with Z dash. It is because the difference between the pulse duration. Faraday current has shorter pulse duration, whereas galvanic, as we know, it is the longer duration current. Now what is the significance of area under the curve? It is the area under the curve which denotes the number of or the amount of charge that actually gets transferred to the tissues and that actually stimulates the underlying tissues. So when we say that we want to increase the effect of stimulating current, we are actually increasing the area under the curve or amount of charge that gets transferred. Now what has to be done to make Z and Z dash equal? If we want to increase the area in case of Faraday current, what can we do? Either increase the duration or increase the intensity of current. Now we cannot do any modification to the duration of the current with our traditional electrical stimulator. So only thing in our hand is changing the amplitude or increasing the amplitude to match with the area. Now in this case, okay, we have obtained the equal amount of charge that are getting transferred into the tissue, Z. The area has increased, and here we can see the area has increased. The pulse duration, as we know, is lesser or smaller. Pulse duration is smaller for Faraday current. It is longer originally for galvanic current. Now what is the difference? The amplitude that we are using for Faraday current is more compared to the amplitude used for galvanic current. So with the lesser amplitude, galvanic current can achieve the equal amount of charge that gets transferred into the tissues. Now what is the implication of this area under the curve? It is the reason for this particular shape of SD curve. With the longer duration of current, we require lesser intensity. With the lower duration or smaller duration current, we require the high intensity to produce the same effect. Now this is called as strength duration curve, but this SD curve is not as simple as seen in the previous page. If we plot various characteristics along the strength duration curve, it comes like this. The x-axis denotes duration and y-axis denotes the strength or intensity of current. Now, when we plot for the sensory threshold and motor threshold and pain limit, this zone will be called as galvanic zone because it is the longer duration current zone, and this zone will be called as Faradic zone. Now, in galvanic zone, we can see the gap is lesser between these three lines, red, blue and black lines, whereas in Faraday current the gap is more. So once the setting is at below the duration is kept below the 10 milliseconds or 1 milliseconds, then first nerve that will get stimulated will be sensory nerve, and then after a significant increase in the intensity, only motor nerves will get stimulated, and after that further increment will lead to stimulation of the pain fibers. Whereas in the galvanic zone, a little increase in intensity will stimulate motor and pain fibers. So what is the implication of this? Window to increase the intensity is larger because of relatively larger gap. We can move more up and down with the intensity knob in case of Faradic, but not in case of galvanic current. Little increase in intensity will provoke pain. So we'll move to our question. We have not answered our question. Now we'll just, after having a look at Faradic and galvanic current, we'll just have a look upon innervated and denervated muscle also. Now what are the muscle types? Innervated and denervated. Innervated means the motor nerve is intact, and denervated means the motor nerve has either damaged or degenerated because of any of the proximal neuronotmesis or axonotmesis injury or complete injury to that motor nerve. The further there will be degeneration, anterograde and retrograde degeneration, and that will lead to the denervation of that particular muscle. Now, what happens when you try to stimulate innervated or denervated muscle? We can see this figure. Now this is innervated muscle. In innervated muscles, we can see the nerve fibers are intact. The nerve fibers are supplying the muscle. So, when we stimulate with one cathode and anode, there are nerve fibers that will be approached by the electrical current first. And in case of denervated muscle, there are no nerve fibers. All nerve fibers have been either damaged or degenerated. So muscles will be approached by the electric current that gets transferred into the tissues. Now we have to have a look upon the resting membrane potentials of nerve and a muscle. It is minus 70 millivolt for nerve, and for muscle it is minus 90 millivolt. Now, minus 70 or minus 90 is resting membrane potential. At rest, it maintains the membrane potential of minus 70 and minus 90. If with the voluntary stimulation or voluntary will or electrical stimulation, it reaches to the level or threshold of minus 55 millivolt, it will fire an action potential. So which one is more easier to stimulate, a nerve or a muscle? For a muscle, we have to travel along minus 90 to minus 55. So the difference is 45 or 35. And the difference between the resting membrane potential of nerve and the threshold is just 15. Minus 70 to minus 55. So the journey from minus 70 to minus 55 is relatively easier than minus 90 to minus 55. So whichever current we are using to stimulate the innervated muscle, you are stimulating the motor nerve. Remember the lower resting membrane potential. Now if you are stimulating any denervated muscle, you are trying to raise the resting membrane potential of muscle cell membranes to the threshold level. If you remember this figure, if we are stimulating this particular muscle or innervated muscle, we are basically stimulating nerves or nerve fibers, because the nerve fibers will get stimulated first or earlier than the muscle, because they require the lesser amount of current. If we further increase the amount of current, it might be the case that muscles are also getting stimulated. But in case of denervated muscles, it will be only the muscles that will have to be stimulated, that is minus 90 to minus 55. So where's our answer anyways? Why Faradic for innervated and galvanic for denervated? So we have to keep few things in our mind, few things to remember in order to understand. First one is type of contraction elicited by Faradic or galvanic. What is the type of contraction? Suppose there are two types of patients with their muscles innervated or denervated. If we use Faradic in case of innervated muscle, it will produce tetanic contraction, and the galvanic one will produce brisk contraction in case the muscle is innervated. So why does the Faradic produce tetanic and why does the galvanic produce brisk contraction in case of innervated muscle will be the topic for discussion for our next video. Now, this is one thing to remember. Faradic current produces tetanic contraction in case of innervated muscle, and galvanic produces in the brisk contraction in case of innervated muscle. Now, what is the use of this tetanic contraction or brisk contraction? When we say tetanic contraction, it resembles a little with our voluntary contraction. So we would like the electrically elicited contraction to match with the voluntary contraction, because the patient cannot contract together with brisk contraction. So if we want the patient to contract the muscles along with the electrical stimulation, then we have to go for Faradic. And in case of, so this is one thing about the Faradic and Galvanic and type of contraction elicited. And if we speak about the denervated muscles, for denervated muscles, galvanic will produce sluggish or worm-like slow contraction, and Faradic, it is the same slow contraction. Now, the second thing that we need to remember is area under the curve or area under the wave for Faradic and galvanic current. If we look at this, to achieve the same amount of charge that gets transferred, we require higher intensity in case of Faradic, but the intensity required is lesser in case of galvanic current. Suppose, when do we need more intensity to stimulate? In case of nerve or in case of muscle? In case of nerve, we require lesser intensity because the gap or the journey is smaller. In case of muscle stimulation, which we require in denervated muscle, the journey is long. We require more area under the curve or more amount of charge to get transferred. Suppose the muscle is innervated. Innervated means the journey is smaller, the lesser amount of charge will do for us, and we can go for Faradic because Faradic will induce tetanic contraction. Suppose the journey is long and we want to stimulate the denervated muscle, or we want to stimulate the muscle directly, the area under the curve or the amount of charge required to stimulate will be more. So if we can achieve that thing with the lesser intensity, that would be the favorable one, because it is the intensity that produces the discomfort. The lower intensity will produce lesser discomfort for patients, and higher intensity will produce the higher or more discomfort to the patient. Now, what is the third thing that we have to take care? Window available to increase the intensity for Faradic and galvanic current. Now, if the individual muscles can be stimulated with the Faradic current or the muscle is innervated, we would like to go for low duration, because we can go with the higher intensity and the limit of pain is farther. If the muscle is denervated, we would go for galvanic because the range required is smaller, and we can achieve that contraction in the denervated muscle faster because it gives more area under the curve with the lesser intensity. Now, inspiration for this video is Mr. Vijay. Thank you for being with me. We'll have a quick revision. We dealt about the lower frequency currents, the differences between Faradic and galvanic, the frequency range, pulse duration 50 to 100 for Faradic and less than 30 for this one, pulse duration less than 1 milliseconds, and this one, the frequency or the duration knob in our electrical stimulator. What is the meaning of area under the curve, and what is the use of the amplitude in reference to the area under the curve, and how do we get this particular shape in this SD curve, and what are the shapes of these particular curves if we are looking for sensory threshold, motor threshold, or pain. So now we know that muscles, innervated and denervated. If we are stimulating the innervated muscles, we are stimulating the nerves basically. We are not stimulating the muscles till the intensity is pretty high. Okay, if it is denervated muscles, then we are stimulating directly the muscles. Now, in case of any correction or any suggestions, please comment below to help me to improve, and we will see further concepts in upcoming videos.